Hello everyone. I'm going to start the series of lectures on the first chapter of Robbins, that is cell injury, cell death, and adaptation. I'll cover only those topics that are frequently asked in the theory exam so that you can handle the answer in an effective way. So, starting with the first topic, that is the reversible and irreversible injury. This is how a question will be asked. That is, what is reversible and irreversible cell injury, or tabulate the difference between the reversible and irreversible cell injury. Usually, these questions are asked in a 5-mark answer. So, this is how your answer will look on answer sheet like this. So, starting with the topic, that is what is reversible and irreversible cell injury. What is cell injury? Cell injury is defined as the effect of variety of stresses due to etiological agents a cell encounters, resulting in changes in its internal and external environment. What does it mean? It means that a cell, when it is encountered to certain stimuli, that will lead to certain changes in the cell, and that will lead to the internal and external environment changes of the cell. Then, this is the flow chart showing how the reversible and irreversible cell injury occur. When a normal cell is exposed to a stress, when a normal cell is exposed to stress, it will lead to adaptation in the cell. And when the cell will be unable to adapt, it will lead to cell injury. Or when the normal cell is exposed to certain injurious stimuli directly, that will lead to cell injury. When this cell injury is mild or transient, that will lead to reversible injury. And if this reversible injury, or when reversible injury occur and the cell and the injury reverts back, or the injury, we remove the injury point, then it will lead to the reversal of the cell to the normal state. If this cell injury is severe and progressive, that will lead to irreversible injury, and this irreversible injury will lead to cell death, that is, necrosis and apoptosis can occur in the cell. Now, what are the causes of cell injury? Causes of cell injury, the most common cause of cell injury is hypoxia or ischemia. Other causes of cell injury are the physical agents like trauma or extremes of temperature or changes in the pressure, radiation, or the electric shock. These all will lead to the cell injury. Other causes of cell injury are chemical agents, infectious agents like bacteria and viruses, immunologic agents, genetic abnormalities like inborn error of metabolism, and nutritional imbalances like poor diet, anorexia nervosa, or the obesity. How the progression of cell injury occur? This structure show the progression of the cell injury. How cell injury occurs? Like when the duration of cell injury is for a short time, like just for few seconds or very short time, that will lead to reversible cell injury. And in reversible cell injury, what happens? The cell functions decreases, the cell function decreases. And if at a certain point from where the cell can't revert back to normal state, if the stimuli continues, or the duration of injury is for longer time, that will lead to irreversible cell injury. And irreversible cell injury first will show us the biochemical changes, then ultrastructural changes, light microscopic changes, and gross changes. Then in the last, gross changes would be visible. What is reversible cell injury? Coming on to the main topic that is asked in the question, that is, what is reversible cell injury? Reversible cell injury is defined as structural and the functional alteration in the early stages and the mild form. In early stages and mild form of the cell injury, which are correctable if damaging stimuli is removed. I hope you get it the point that what I was trying to tell you, that these are structural and functional changes in the early stages and mild form, and the cell can revert back to the normal state if the stimuli is removed. How the reversible cell injury occur? This is shown by like what is the mechanism by which the reversible cell injury occur. That is hypoxia. The cell is exposed to hypoxia. That is, there is decrease in oxygen concentration. It will lead to the mitochondrial dysfunction. Mitochondrial dysfunction is the first change of the cell injury. This is the first change of the cell injury. This mitochondrial dysfunction will lead to decrease in the ATP levels. Since we know our cell has three forms, that is, it has a cell membrane, it has cytoplasm and the organelles, then it has a nucleus in the center. Now, decrease in the ATP level would lead to changes in all the three forms. It will lead to change in cell membrane, in the cytoplasm, and changes in the nucleus too. Now, what happens to the cell membrane? Cell membrane changes. There will be disruption of the sodium potassium ATPase pump. Normally, what happen? Normally, two potassium moves in and three sodium moves out. And in hypoxic state, what would happen? Two potassium will move out and three sodium will move in. Since we know if three sodium move in, water will accompany and the cell will undergo swelling. That this would lead to cell swelling or the hydropic changes. Cell swelling and the hydropic change is the first morphological change of the cell injury. What was the first change? First change was the mitochondrial dysfunction. And what is the first morphological change? That is cell swelling. Uh, Plasma membrane will undergo blebbing, blunting, and there will be loss of microvilli. Since more and more water will accumulate in the cell, that will lead to bleb formation in the cell. Like if more and more water will accumulate in the cell, it will lead to formation of blebs like this. The water will cause the blebbing formation in the cell. Now, moving on to what happens to the cytoplasm. Cytoplasmic protein changes, what will happen? It will lead to the fatty changes. And what will happen to the nucleus? There will occur the nuclear chromatin clumping. I will let you know how in further discussion. Since we know there are organelles in the cytoplasm, what will happen to the organelles? The mitochondria will undergo swelling, endoplasmic reticulum also undergoes swelling, and there is formation of myelin figures. What are myelin figures? Myelin figures are actually the concentric lamellations seen on the electron microscope. That are these myelin figures are made up of the phospholipid and calcium. These are made up of phospholipid and calcium. This usually is asked in the viva questions, how of what the myelin figures are made up of. Myelin figures are made up of phospholipids and calcium, but most predominantly these are made up of phospholipids only. And these are seen in both reversible and irreversible cell injury. They are not characteristic of the irreversible cell injury, they are seen in both reversible as well as irreversible cell injury. These are seen more in the irreversible cell injury but seen in both. Moving on to further condition, how the nuclear changes occur. Since we know hypoxia occur, decrease in ATP formation occur, and decrease in ATP will lead to anaerobic glycolysis in the cell. Anaerobic glycolysis will lead to increased formation of lactic acid, and this lactic acid accumulation will decrease the pH of the cell and will lead to the nuclear chromatin clumping. And how the cytoplasmic changes occur? Cytoplasm, there is disruption of the metabolic activity, or the metabolic pathway will undergo disruption, and there will be rapid accumulation of the triglycerides, and triglyceride accumulation will lead to the fatty changes. Now, moving on to the next topic, that is irreversible cell injury. What is irreversible cell injury? As I was telling you, there is a certain point. If the injury moves beyond that point, that will lead to irreversible cell injury. That is persistence of ischemia or hypoxia results in irreversible damage to the structure and the function of the cell. And two essential phenomena are: there will be mitochondrial damage and there will be disruption of the cell membrane. And how and what is the mechanism of irreversible cell injury? I'll show you again. So, this is the mechanism of cell injury. This whole is the mechanism of cell in irreversible cell injury. How this happen, I'll let you know step by step. So, what is most common cause of cell injury? That is hypoxia and ischemia. If this hypoxia continues for more time, that is, it continues for the longer duration, that will lead to decrease in ATP generation. This decrease in ATP generation will lead to increase in the cytosolic calcium levels. These calcium level will also increase in the mitochondria and will lead to formation of amorphous flocculant densities. This formation of amorphous flocculant densities will lead to phospholipase activation and protease activation. Phospholipase activation will cause loss of the membrane phospholipid and lipid breakdown products will be formed. And protease activation will lead to cytoskeletal injury. These all things will lead to membrane damage. This is what I have told you earlier, that there will occur mitochondrial damage and there will occur the membrane damage. Now, if there is decrease in ATP generation, it will also lead to decrease in generation of the membrane phospholipid. Decrease in membrane phospholipid will lead to increase in loss of membrane phospholipid, and that will further lead to the membrane damage. Again, decrease in ATP generation will lead to increased formation of free radicals, that is superoxide, hydrogen peroxide, hydroxyline, that will directly lead to the membrane damage. Since there is membrane damage, I have a cell, I have this cell and its membrane got damaged. What will happen? The cytoplasmic contents which are present, they will all move out of the cell. They will all move out of the cell and they will spread. Okay. What are these cytoplasmic contents? These are actually enzymes only. Okay. And if these enzymes will move out of the cell, this is what we measure in a cell, measure in our body when a patient comes with certain injury or certain hypoxic state. This is what we measure. For example, if a patient of MI comes to the emergency department, how would we determine that this patient is suffering from MI? What we will do, we will measure the CPK-MB levels, because the myocardial cells, they contain the CPK-MB, and we will measure those content. We will measure CPK-MB levels and determine as this if this patient had MI or not. Okay. So, the membrane damage will lead to liberation of the intracellular enzymes, and these intracellular enzymes will lead to the cell death and even the myelin figure formation. We will measure the serum enzyme levels as in SGOT, as LDH levels, CPK-MB. In a liver condition, we will measure SGOT. In heart levels, in heart condition, we will measure CPK-MB, and all these things are very essential. Then nuclear changes, what the nuclear changes will occur? There would occur pycnosis, karyorrhexis and karyolysis. I will explain these three terms later on. Now, moving on to the second question that I showed you, that is the tabulate the difference between the reversible and irreversible cell injury. This question is asked separately as well. So, here is a table depicting reversible cell injury, irreversible cell injury differences. So, we have a cell. It has three parts. It has a cell membrane. It has cell membrane. It has cytoplasm, which has organelles, and it has a nucleus inside it. Okay. And the what will happen? The cell injury will cause the impact on these three things. Okay. So here also we will move forward step by step. In cell membrane, there will occur cell swelling, bleb formation, and myelin figure formation in reversible cell injury. And what will happen in irreversible cell injury? The cell membrane will undergo disruption. This is what I have discussed just now, that there occurs cell swelling in reversible cell injury and disruption in irreversible cell injury. Myelin figures will be found in both, but there will be numerous in the irreversible cell injury. Then moving on to cytoplasm that has organelles. First is mitochondria. Mitochondria will undergo swelling and amorphous densities formation in reversible cell injury. And in irreversible cell injury, there will be formation of vacuoles and large flocculent amorphous densities. Rough endoplasmic reticulum and ribosome, there would occur swelling and dispension of the ribosome, and in irreversible cell injury they will undergo lysis. Lysosomes will undergo autophagy in reversible cell injury, and these will be swollen and ruptured in irreversible cell injury. Cytoskeleton would be aggregated in reversible cell injury, and it would be disrupted in the irreversible cell injury. Moving on to the nucleus, the last part, that there will be clumped chromatin. There will occur the chromatin clumping in the nucleus. Okay, and that was because of the increase in the lactic acid formation or decrease in the pH of the cell. And in irreversible cell injury, what will happen? There will happen pycnosis, karyorrhexis, and karyolysis of the nucleus. So this is how we will write an answer for the question if an question is asked on reversible cell injury, irreversible cell injury, um, or they ask for a difference for us, or even they can directly ask us what is cell injury. This is how we will write the answer. Thank you.